The pharmaceutical industry desperately hopes you never discover this. Your primary care physician probably won't mention it during your annual checkup. But there's a single spice costing less than a dime and likely already sitting in your pantry at this very moment that, when paired with your daily morning coffee, accomplishes something no expensive supplement bottle can replicate. And chances are you've been preparing it incorrectly your entire life. This sounds absurdly simple, but wait until you hear what occurs inside your cardiovascular system, your digestive tract, and your brain within the first 15 minutes after consuming properly prepared coffee infused with this spice. If you're over 60 and experiencing even one of these persistent mental cloudiness that lingers until midday, uncomfortable abdominal distension after eating, erratic glucose fluctuations, subtle joint discomfort, and stiffness when you first wake up, unrelenting tiredness despite getting a full night's rest, then what I'm about to reveal could revolutionize your mornings starting as soon as tomorrow. Because here's what 99% of the population fundamentally misunderstands about their morning coffee ritual. Coffee isn't merely a caffeine delivery system. It represents one of the most concentrated sources of beneficial polyphenols in the typical Western diet, particularly chlorogenic acid, a potent antioxidant that safeguards liver function, regulates glucose metabolism, and suppresses inflammatory pathways. Now, here's where it gets fascinating. Clove contains a bioactive compound called eugenol, and clove happens to be the most concentrated natural source of eugenol anywhere on Earth. No other culinary spice comes remotely close. Eugenol functions as a natural anti-inflammatory agent that, in certain research studies, demonstrates comparable effectiveness to ibuprofen. Here's where the transformation happens. When you combine chlorogenic acid from coffee with eugenol from clove, they don't simply add together, they amplify each other's therapeutic effects exponentially. 1 plus 1 in this biochemical equation doesn't equal 2, it equals 10. Nutritional scientists call this phenomenon food synergy, and you're about to leverage it for the price of a single dried clove. But before I walk you through the precise preparation method, let's address something honestly. Most Americans are systematically destroying their coffee's health benefits every single morning without realizing it. Adding sugar? You've just triggered an insulin spike and eliminated roughly half the antioxidant capacity. Pouring in milk or cream? The casein protein binds directly to polyphenols and prevents absorption. Using instant coffee? The majority of polyphenols get destroyed during industrial processing. That flavored latte from the coffee shop with syrup and topping? You've taken one of nature's most therapeutically powerful beverages and transformed it into a sugar bomb that merely tastes like coffee. You're not consuming coffee, you're consuming a liquid dessert with a coffee aroma. I'm Dr. James Whitemore, and I've spent 15 years in integrative and functional medicine working with aging populations. What I'm sharing today represents a protocol I now recommend to every patient over 60 who walks through my door complaining about inflammation, metabolic dysfunction, or digestive issues before we ever discuss conventional pharmaceutical interventions. Now, here's exactly what happens inside your physiology when you consume properly prepared coffee with clove. Within the first 15 minutes, you'll experience something distinctly different. Energy without that characteristic jitteriness, without that anxious tension in your chest that standard coffee frequently produces. Eugenol gently relaxes smooth muscle tissue, including the muscular walls of your blood vessels. The caffeine provides the energizing effect. The clove eliminates the anxiety response. You get mental clarity without the chaos. Within 24 hours, the first change most people notice involves digestion. Clove possesses documented carminative properties, meaning it actively reduces intestinal gas and bloating. Coffee naturally stimulates gastrointestinal motility. Combined, they efficiently clear your digestive tract within the first day. People consistently report a physical lightness they haven't experienced in years. Within 72 hours, your glucose metabolism begins stabilizing. Chlorogenic acid decelerates glucose absorption in the intestinal tract. Eugenol enhances insulin receptor sensitivity at the cellular level. Those dramatic sugar fluctuations where you feel ravenous 60 minutes after eating start leveling out. But here's where the science becomes truly compelling. Before we continue, a quick request. 99% of viewers haven't subscribed yet. If you're finding genuine value in this information, take just a moment to subscribe and like this video. We're working toward 100,000 subscribers by month's end, and your engagement genuinely matters. Thank you. Let's continue. Within 1 week, systemic inflammation begins declining. This happens quietly beneath the surface, but if your knees ache when you first stand up in the morning, you'll notice the discomfort diminishes. If your fingers chronically swell, the swelling reduces. If you experience morning stiffness, the duration shortens. This isn't miraculous. This is whole body inflammation decreasing, and it's quantifiable in laboratory blood markers. Within 1 month, your liver function transforms. Clinical research demonstrates that regular coffee consumption correlates with reduced rates of hepatic steatosis and liver fibrosis. Eugenol magnifies this protective effect by reducing oxidative damage in hepatic cells. Your liver enzyme levels may begin normalizing. Your skin clarity improves because a liver that detoxifies more efficiently means fewer metabolic waste products attempting to exit through your skin tissue. People frequently mention they appear more youthful after 30 days. Within 3 months, systemic physiological transformation occurs. Body weight may begin decreasing. Coffee is a clinically documented thermogenic compound, and improved insulin sensitivity translates to reduced fat accumulation. Cognitive performance improves measurably. Your energy becomes sustained rather than spiked and crashed. All of this from one spice added to the coffee you're already consuming daily. Now, the exact preparation protocol, because 90% of people who attempt this make one of 3 critical errors and experience virtually no therapeutic benefit. The correct method is called decoction. Step 1. Take 3 whole cloves, not pre-ground, not powdered. Whole dried cloves from your grocery store spice section. Step 2. Place them in a small saucepan with 10 ounces of water, roughly 1.5 cups. Bring to a rolling boil, then reduce heat and allow a gentle simmer for exactly 5 minutes, not longer. Extended cooking causes eugenol degradation. Step 3. Strain the liquid. Remove and discard the cloves. Step 4. Use this clove-infused water to brew your coffee through whatever method you normally use. French press, automatic drip, pour over, single-serve pod system, the method doesn't matter. Step 5. Consume slowly on a completely empty stomach. This should be the very first substance entering your digestive system in the morning. That's the complete protocol. 1 cup, 1 time daily in the morning hours. The accelerated method for rushed mornings. If you don't have 5 minutes available for decoction preparation in the morning, here's an expedited approach. Take 1 whole clove, crush it in a mortar and pestle, or smash it with the flat edge of a kitchen knife. Drop it directly into your freshly brewed black coffee. Allow it to steep for 3 minutes. Consume. This delivers approximately 60 to 70% of the full therapeutic effect compared to proper decoction. Better than nothing when time is limited. Now, the 3 preparation mistakes that completely eliminate the therapeutic effect. Most people make at least one without realizing it. Mistake 1. Dropping a whole uncrushed clove into already brewed coffee. Clove is an exceptionally dense, hard spice. It cannot release bioactive compounds without either heat extraction or physical crushing. You'll get a subtle aroma and zero actual benefit. Mistake 2. Boiling clove for longer than 5 to 7 minutes. Eugenol is thermally sensitive. Prolonged high heat exposure destroys the molecular structure. More time is not better here. Mistake 3. Adding dairy milk, cream, or sweeteners afterward. This eliminates 50 to 70% of polyphenol bioavailability through binding and interference. If you absolutely cannot drink it black, add a small amount of coconut oil or a pinch of cinnamon instead of conventional dairy. An important safety note regarding who should avoid this protocol. If you're currently taking anticoagulant medications like warfarin or high-dose aspirin therapy, consult your physician first. Eugenol possesses mild anticoagulant properties. If you have active gastritis, a diagnosed ulcer, or severe acid reflux, coffee itself may not be appropriate for you regardless. Clove won't resolve that underlying condition. For everyone else, this represents one of the safest, most therapeutically powerful preparations you can create with ingredients already in your kitchen. Consider the economics. One clove costs less than 10 cents, 5 minutes of morning preparation time, and your coffee, the identical beverage you've consumed for decades, transforms from a simple habit into an active intervention for your physiological health. Within 15 minutes, mental clarity without anxiety. Within 1 week, measurably reduced inflammation. Within 1 month, enhanced liver detoxification. Within 3 months, a complete metabolic reset. Let me share a patient story that illustrates this perfectly. I'll call him Robert. Robert was 67, a retired engineer, meticulous about following health advice. He'd been drinking black coffee every morning for 40 years. He came to my practice because of symptoms his conventional doctors couldn't explain. Persistent afternoon energy crashes, chronic knee pain that made walking his dog painful, and stubborn abdominal bloating after nearly every meal. His standard medical workup showed nothing alarming. When I introduced him to this exact clove coffee protocol, he was skeptical. He told me, "I've been drinking coffee my whole adult life. How can one spice make any difference?" 8 weeks later, he came back for follow-up. The knee pain had reduced by what he estimated as 70%. The afternoon crashes were gone. The bloating had completely resolved. He told me, "I drank coffee for 40 years and it was just coffee. You showed me how to drink it correctly and it became medicine. Why didn't anyone explain this 40 years ago?" That's the gap this video addresses. The research exists. The mechanisms are published in peer-reviewed journals. But the standard medical appointment isn't structured to teach patients how to optimize simple daily habits for maximum therapeutic benefit. That's precisely why this content matters, because none of this works unless you actually implement it. You're not physiologically broken. Your coffee preparation is broken. Fix the coffee preparation. Fix the morning routine. Start tomorrow morning. 3 whole cloves, 5 minutes of gentle simmering, 1 cup of properly prepared coffee. That's where systemic transformation begins. And if you know a neighbor, a friend, or a family member over 60 who drinks coffee every single morning, share this video with them immediately. It might be the simplest yet most impactful thing you do for their health today. Subscribe now for more evidence-based, practical health strategies that transform simple daily habits into powerful therapeutic interventions. Take control of your mornings. Your body will respond. Disclaimer: everything presented in this video constitutes general educational information based on published research in nutritional biochemistry and functional medicine. This is not personalized medical advice. If you have existing medical conditions or take prescription medications, consult your healthcare provider before implementing new dietary protocols. They understand your specific health situation. This information serves as an educational starting point, not a replacement for professional medical guidance.